Thank you. Hi, I'm Jill Melia. I work at St. Mary's Secours, and I've been in this role. It was called originally the nurse co-pilot or cardiac surgery co-pilot. The pilot is the patient, and I'd be their co-pilot to kind of help them go through surgery. And the way the role started was our previous surgeon invited 3 of his patients with 3 different experiences in the hospital and asked them, what did we do right, what could we do better? And the common theme was communication. And they found that a patient could have up to 15 different nurses caring for them. Then you have the different providers, and they were getting mixed messages, and patients were confused. So they hired me. I was a previous CDI nurse, and I kind of, like you, developed the role, figuring out what I needed to do, what the patients were looking for. And so this, I just kind of ran down my typical day, and it has changed a little bit as I find different needs from different patients. So I used to try to meet with the patients in pre-op holding, just kind of ease their fears and see a familiar face. And then I pre-round with the patients and see if they have any questions or concerns before the physicians arrive. And then we all round together as a cardiac surgery team. So I will hear what the physician is saying, and I will share what the patient's concerns are for the day. We had something today where a mid-level told the patient would be NPO, but forgot to kind of put the orders in and tell the bedside nurse. So I was able to go back and say, wait a minute, they're concerned about an ileus. We're not feeding this patient right now. They're back on clear liquid. So those little things that can get lost in translation, I think is helpful and beneficial to be part of that. And then I do update families during surgery. So one of the major goals is letting them know when we get started. The OR team lets me know when we get started, when they're halfway done, to kind of ease the patient's family's concerns. They're there at 4:30 in the morning, and they won't see a surgeon until 12 or 2. So it's kind of nice to get that face down there. Do you need anything? You're good. And then I round on the regular inpatients like you do education. We also had issues with the incentives barometer, so I made a video in the cardiac surgery office, and that's linked on our homepage so nurses can pull up how to teach proper use of the incentives barometer. And we also have tools at the bedside, checklists of what patients should be doing out of bed for meals. And the checklist also follows their home discharge checklist. So they should be doing the incentive 10 times every hour and getting out of bed and ambulating and working with physical therapy. So that's at the bedside for the patients in the step-down units, and they also get a copy of that when they go home. It kind of correlates with that. And then, does it go up a little more? Yeah. That's it, okay. So anyways, in going bed, room to room, I try to just help the patients understand what the plan of care is for that day. And that's helpful. And then when the families come in, I can share with them as well what their rounds will be discussed for the day, what our discharge plan is. And then I try to run down to the office and see the post-op patients. Our patients come back 3 to 5 days after surgery, and they come back again to see the surgeon in a month. And I think one of my biggest jobs is physician interpreter. And I think I'm doing very well with it. I like to write a book. But just helping the patients, family members understand what coagulopathies are, hemostasis issues, oozy patients, those kind of things. I think when the surgeons tell the families, they really have no idea what you're talking about. And sometimes our surgeons will tell the families one thing and it doesn't really get translated up to the bedside nurses, so I can run upstairs and say, by the way, this is what was said to the patient's family, so we all know what they heard and it's not a mystery. So that's been kind of fun. And then I do try to call all of our patients the day after discharge. And that is, did you get your medication? Did you sleep well? Have you heard from home health? All of our patients get 2 weeks of home health care. They visit 3 times a week. We felt that way. Tracy Sheehan was instrumental in this project. It was called the Co-Pilot Project, and she pulled all the data. And what we did find with the cardiac surgery Co-Pilot, using retrospective data, it decreased the length of stay and readmissions, 30-day readmissions for cardiac surgery patients. So right now there's only one of me, and it's going to be spreading to our other hospitals as well.
And how many patients do you touch a day, figuratively speaking?
A lot. Probably, I would say 12 to 15 patients inpatient. We get consults. I try to see those patients at the bedside before they go to surgery the next day. We pre-admit them for insulin drips or heparin bridges. So I try to see those as well. So we do, I think, how many surgeries do we do a month, Tracy?
A month, anywhere between 30 and 50, depending on how busy they are.
Thank you, Jill. Is it Liza?
Liza is next, yeah. So